A lot of times people might come to me with a thyroid problem, and then when I test them, they're developing insulin resistance, they're pre-diabetic, they're diabetic, they're developing that. Or I'll have diabetics come to me and I'll test their thyroid and see that they're developing thyroid issues like hypothyroidism, or they're pushing in that direction. Less likely, but sometimes even hyperthyroid issues, these types of things. So, why is the thyroid so important for blood sugars? Really, your thyroid, in my mind, the way I like to explain it, is kind of like the gas pedal to your metabolism. So if you think of low thyroid, it's like taking your foot off the gas. We call that hypothyroidism. And if you imagine if your metabolism really slows down, what does that mean? It means you're not going to be utilizing and burning up the glucose and the sugars that are in your system as fast and efficiently as you should be. So what happens is slow metabolism due to your thyroid being off. Next thing you know, blood sugars can rise, and vice versa. So sometimes if you put pedal to the metal, some people out there have hyperthyroidism. Hyperthyroidism, not always, but has the opposite effect where it'll ramp you up. Sometimes hyperthyroid people can have bulging eyes and lose a lot of weight, much more anxiety as opposed to low thyroid with depression. It kind of ramps you up. But at the end of the day, where thyroid hormone is really important too, other outside of the metabolism, if your thyroid hormones are off, can have some detrimental effects to the insulin receptors and how your body processes insulin. So, for a handful of reasons here, it's so important that on the path to improving your diabetes, reversing diabetes, getting better blood sugars, one of those key areas to look at and optimize is your thyroid. So, when I say that, you do not have to be diagnosed with a thyroid condition for you to have thyroid imbalances. So, when I talk about this, we're talking from a functional approach. Way before you get diagnosed with a thyroid disease, there's some breakdown, dysfunction, imbalances, and a lot of times I catch it here before anyone is actually at diagnosable levels. So when we find that, we want to address the thyroid. We want to make sure it's taken care of. We also want to understand why is the thyroid having thyroid problems other than just the blood sugars if you're a type 2 diabetic. So here's a couple things. There's some key nutrients. The foundational things is clean up the diet, get some exercise, good sleep, watch your stress. That's going to be the foundation no matter what condition you tell me. But let's stack to the next thing. We're going to evaluate the thyroid. Do you have some thyroid hormone imbalances? Do you have some nutrient deficiencies? There's some key nutrient deficiencies I see with people with thyroid issues. So the most common ones that anyone's going to find online, iodine and selenium. So iodine and selenium, they're very, very important in the production of thyroid and the protection of the thyroid gland and thyroid hormones. They're going to be big, important nutrients for the function of the thyroid. Other things like zinc, iron, vitamin D, and omega-3 fatty acids. These are some of the most important nutrients for good thyroid hormone health. And when we have good thyroid hormone health, we have typically a better metabolism. With a good, healthier metabolism, we can burn through those blood sugars better and have better regulated blood sugars. Now, I'm going to give one little side note, and I don't want it to be too complicated or too dense, but one thing that if you're suspecting you have a thyroid issue, please ask your doctors, please have your thyroid evaluated for Hashimoto's. Autoimmune disease is the number one cause of thyroid disorders, especially hypothyroidism. So if you don't know that and you're just taking these thyroid recommendations off of what you read online or what you just heard me say on a video, you might be addressing the wrong things and you might be adding to the problem. Let me explain. For the autoimmune thyroid Hashimoto's people out there, where your immune system is attacking your thyroid and creating thyroid issues, in those instances, many times you do not want to be supplementing with iodine. especially high doses of it, because it can ramp up and add to that issue. So if you have a known thyroid problem, your doctor says you have hypothyroidism, you may even be prescribed levothyroxine or synthroid. Make sure to ask him to evaluate you for an autoimmune thyroid. There's a few tests he should or she should know what those tests are to evaluate for the autoimmune component, in which case it may not be appropriate to do high dosing of some of those nutrients I mentioned. Also, you might have it from your own experience. I know not everybody can get to the doctor. Not everyone can have these conversations and have blood work done all the time. So you might notice it from your experience. If you have a thyroid condition and you start supplementing with a whole bunch of iodine, and you might even find yourself getting worse or having more issues, definitely time out and get some stuff evaluated. At the end of the day, this is why when we get into the nuances of healthcare and root causes, it's hard for me to give a sexy answer because I've seen a lot of different perspectives. And at the end of the day, a customized and an individualized approach to your care is typically best with the clients I work with. I think many of the clients that are with me, they came to me because the general advice and the general recommendations and blogs and YouTube videos was not working, and in some cases, maybe even making them worse.